Hello and welcome to the panel discussion to address strategies for Part C and B 619 integration into a mixed delivery system. I'm Sally Shepard, TA Specialist with the PDG B5 TA Center. Outcomes for this panel discussion include strategies to increase the coordination of services to young children with disabilities and their families. And just as a reminder, the content of the presentation were developed by the presenters for the 2021 OSEP conference. However, these contents do not necessarily represent the policy of the Department of Education, and you should not assume endorsement by the federal government. I'd like to introduce our next speakers. From Colorado, we have Kristen Lang, Program Access Manager, Office of Early Childhood, Colorado Department of Human Services. Wayla Moreau, Training and Technical Assistance Team Lead, Early Intervention, Colorado, Colorado Department of Human Services. And Marcia Blum, Preschool Special Education, Instructional Technology, P3 Office, Colorado Department of Education. From Louisiana, we have Britt Braun, 619 Coordinator, Early Childhood Academics, and Leslie Doyle, Early Childhood Chief of Staff and Director of Early Childhood Academics. And from Minnesota, we have Kat Tominga, Part C Coordinator, Safe Learning Plan State Support Team, Testing Coordinator. We also have Richard Gonzalez, Director of the Interagency and Special Initiatives within the Department of Health and Human Services, Administration for Children and Families, with us today to open our discussion. Richard, can you share a few words?
Yes, thank you, Sally. So most of you will not know this about me, but I am the father of a son who's on the autism spectrum. His name is Nicholas, and last week he celebrated his 26th birthday. Nicholas has limited language and communication capability and will never be able to live on his own. But in the last few years, Nicholas has made tremendous strides, including getting a part-time job, 9 hours a week, working at Trader Joe's, and living part-time in his own apartment with attendants who help him address his needs. And these things are things of which he is very proud. Yet despite these later successes, it has not always been easy. And Nicholas, my wife, and I have had many challenges in his earliest years and throughout his elementary years and high school years. Not surprising to you, his greatest successes, our greatest successes, came from individuals, service providers, teachers, consultants, committed to making a difference, committed to helping Nicholas and his parents understand what services were available and how to navigate the system. I tell you all this because I have a personal interest in seeing our state systems get better at helping children like Nicholas so they too can grow into happy and healthy young adults. So let me tell you a little bit about PDG Birth to 5 and why it is so important to Nicholas and others like him. While doing so, I'll also want to emphasize the essential role Part C and Part B 619 coordinators play in strengthening statewide early childhood systems. The Preschool Development Grants Birth to 5 initiative is designed to assist states in developing stronger partnerships across state agencies, resulting in improved policies and procedures that lead to an increase in the number of children with disabilities who are fully included in each state's mixed delivery system. In addition, the PDG B5 initiative is intended to assist state efforts to increase the number of high quality, inclusive early childhood settings in the state's mixed delivery system. One way states can work toward this goal is to focus on improving and expanding the professional development opportunities for a greater number of early childhood providers, thereby increasing the competencies needed to implement successful inclusive settings. Building a statewide early childhood system is ongoing and complex work. And IDEA Part C and Part B 619 must be an integral part of each state's early childhood system. IDEA programs have much to contribute to early childhood systems building because of their long-standing focus on coordinated service delivery. And Part C and Part B 619 staff can offer resources and expertise to help build, support, and sustain the broader early care and education system. Coordination and collaboration between state agencies and programs providing Part C and Part B 619 services are critical to ensure children receive the continuing supports and services to be successful. State and community leaders from Head Start and Early Head Start, pre-kindergarten, childcare, home visiting, and the various related health services must work with IDEA program staff on statewide system building. Because of all this, states should be answering such questions as what state agencies need to put into place to encourage, support, and require local programs to provide evidence-based practices that result in positive outcomes for young children with disabilities and their families. I am hopeful that Part C and Part B 619 coordinators have played significant roles in each state's development and implementation of its comprehensive statewide birth to 5 needs assessments and strategic plans, as well as its program performance evaluation plan. Finally, I want to remind folks to revisit our 2015 Joint Ed and HHS policy statement on inclusion of children with disabilities in early childhood programs. This statement sets clear expectations for high quality, inclusive early childhood programs and providers with recommendations for state, local education agencies, schools, and early childhood programs. I will now allow you to hear from state presenters from Colorado, Louisiana, Minnesota, who are going to share strategies and lessons learned that I am sure will be helpful to you in your efforts. Thank you so much for this time to speak with you.
Thank you, Richard. Now we'll move on to our panel discussion and let Colorado, Louisiana, and Minnesota discuss strategies to integrate Part C and Part B 619 into their early childhood mixed delivery system. Our first question is for Colorado. Are IDEA Part C and Part B participating in the work of PDG B through 5 or in your state's early childhood mixed delivery system? And if so, how are they included?
Yeah. Hi, Sally. Yes, this is Kristen Lang from Colorado. So in Colorado, our Part C and B programs were integral partners in our PDG implementation team. And so we intentionally designed strategies together with two key areas of focus. One is to ensure that our community-based providers are more aware of what Part C and B programs have to offer the children that they care for and how to connect to them. And the other is to really increase the ability of community-based providers to be able to serve children with a wide variety of delays and disabilities in their community-based setting. So I'm going to kick it over to my colleague, Wayla, to talk to you a little bit about some courses that we built, and then I will wrap it up with some other strategies that we pursued. So Wayla.
Hi, I'm Wayla Merrill. I'm from Part C in Colorado. And so one of the things that we did, we worked together, Part B, Part C, and PDG, to develop some courses that are on our free professional development system for early educators. We call it PDIS. And these courses are to make sure that early educators are aware of how to refer children to Part C or Part B, and to give them some strategies for helping to include children. We've also proposed that our course Preschool Special Education and the Early Intervention Program introduction we proposed that be required for all of the people that are required to register for our PDIS system. So we're really excited about that. It's in our rules. They still haven't passed yet, but we're working toward that, and very excited that that's going to be a required course for the very basic licensure in Colorado. We also worked on a universal design project, and we worked with our assistive technology partners called the Center for Inclusive Design and Engineering. And we developed a universal design package where they provide low-tech assistive technology for child care providers. And also they take a course to help them understand what types of supports might be appropriate for delays in all of the different developmental domains. Kristen, I'll send it back over to you.
Thank you. And just to emphasize, with that PDG Inclusion and Universal Design project, we were able to leverage this existing relationship that Part C and B had with our assistive technology institution to be able to bring that support and expertise into the community-based system of childcare. And so 2 other things I wanted to highlight: we were able to leverage PDG resources to help support development of a new program in our state called, referred to right now as EI Early Start. It's going to be renamed soon, but that is to support children who don't qualify for early intervention and their families in providing developmental support and family support to ensure that we can keep them on the right developmental track. And then finally, our Part C and B and PDG team is working together to talk about how we can promote community readiness for quality inclusion throughout the community-wide birth to 5 system. So I will end there and hear from some other states.
Hi, this is Leslie Doyle with Louisiana. And I just wanted to share a couple of things that we are doing. So in Louisiana, we have early child community networks. We have 65 networks within our state, and they serve as the community network's fiscal agent, and they take on other roles such as coordinating overall duties and responsibilities, meeting with all program partners, which includes childcare, public and non-public, pre-K, and Head Start, and acting as the liaison between the early childhood community networks and the Louisiana Department of Education. And within each of our early childhood community networks, we have a coordinated enrollment process where they annually complete this enrollment process, which is intended to streamline enrollment for families regardless of the educational setting. So all of our providers within our mixed delivery system, including Head Start, early Head Start, public, non-public pre-K, childcare, are all included within this process. And within our enrollment process, each network must submit a detailed plan that specifies how they are reaching the vulnerable populations and the type of information and supports that are available to support enrollment for families who have children with disabilities or who are going through this evaluation process.
Hi, this is Kat Taminga from Minnesota. I have to say it's awfully fun to get to hear from other states and to be a part of this. In Minnesota, Part C and 619 are happily included in our PDG. First, Part C and 619 are purposefully meant to support whole child, whole family, so it just makes sense. Also, Minnesota is a birth mandate state. And so our Part C and 619 are on the same team and in the same division as our PDG team and other programs such as Early Head Start and Head Start. So this allows for proximity, streamlined and consistent communication, and relationship building within all persons and aspects of our PDG and our early childhood systems. In addition, my Part C coordinator position description intentionally includes a percentage towards our Help Me Connect initiative, which has become an integral component of our Minnesota PDG and mixed delivery systems. Help Me Connect is our new interagency navigator, connecting families of young children prenatal to age 8 to self-identified resources that they want and need to be healthy, safe, and strong, including kids with different abilities and their families. Through our PDG, Help Me Connect supports collaborations between providers and is developing regional support hubs for families and a resource connection system created out of our Part C and 619 Help Me Grow referral system, meant to simplify processes for families as a one-stop shop. And this was one of the main desires that families and communities expressed and shared with us through our intensive PDG 1.0, Family and Community In-Reach and Engagement. Help Me Connect has been an interagency collaboration along with many additional partners, including tribal nations, since 2012. And Help Me Connect functions as our new and stronger federally required Part C central resource directory, allowing Part C service coordinators and providers to more fully support whole needs of children and families instead of that traditional siloed approach that we're all trying to change. something that Part C has always been charged with, and which has solidified after this past year of having to provide Part C and 619 services in ways that we all have never done before.
Thanks for that great information, everyone. Let's move on to our second question. And we're going to follow up again with Kat from Minnesota. Can you share some of your lessons learned or strategies you use to overcome the barriers of including Part C and Part B in the state's early childhood system?
Absolutely. So for our lessons learned, being involved in your state's PDG is essential for Part C and 619. We all have the common purpose of doing better for children and families, and we can do better together. PDG is a unifier. It allows for us to focus funding and time on the processes of relationship building and true systems change. It is allowing us to work together towards sustainability and invest in the disruption of what hasn't been working for each and every child and family, centering families of color and those whom our systems were created to marginalize and continue to marginalize today. PDG has helped Minnesota, including our Part C and 619 systems, understand that we must first listen to the voices of the people that we are here to serve, families. They make our Part C and 619 systems stronger. They're why we're here. And they help us automatically encourage greater collaboration for us and, and our mixed delivery partners. Some strategies that we've been implementing. First, intentionally find and create ways to listen to and believe in families. Our entire PDG in Minnesota and the work of all the partners in our still in progress mixed delivery systems come from families and communities and providers sharings with us. If your PDG offers learning and development opportunities, seize these, participate in everything that you can through PDG. And have people from your teams participate too, even when you aren't sure that it will apply to you, because it does. Part C and 619 are the beginning into the systems for so many families of children with different abilities. We are connected to everything that comes before and after and all around for the families that we serve. And these are opportunities for collaboration and relationship building with other mixed delivery systems and other partners so that we can be stronger and better for families. And then finally, write relationship building into your position description as a Part C or a 619 coordinator. Even though we need to work to disrupt the following statement, for now it stands, what gets measured matters. So measure what you hope and need to do to support a mixed delivery system for infants, toddlers, young children with different abilities and their families. If it's in your PD, it is supported in action, funding, and time.
Hi, this is Britt Braun from Louisiana. Thanks so much for having our team on your panel today. As Leslie mentioned earlier in the panel, Louisiana has established our early childhood community networks, and that has really helped develop a strong partnership between our community networks and the Department of Education. And through that process, we've been able to continue to build local infrastructure through our Ready Start networks, which really have taken the role of pioneering, establishing local governance structures to really guide decision-making based on their community needs, as well as improve local coordination and services across mixed delivery systems, and really think through opportunities to increase access to high quality early childhood programs. And we've really established a strong collaboration, and we've learned so much from our Ready Start networks who have helped us think through strategies to continue to overcome barriers. One of those being really thinking through effective ways to establish high quality access when we think about all of the various types of early childhood programs within each of our different diverse communities. And so this past year, we really worked with our lead agency networks and some of our Ready Start networks to launch a pilot program to really focus on building that educator capacity, not only for our special education providers, but also our general ed teachers to really think through an effective way to build capacity among all of our educators to really feel prepared to provide supports to children with a variety of different disabilities. And so with this pilot program, the Department of Education utilized one of our vendor guides, which includes a number of vetted vendors who are able to offer specific professional development and training in specific areas related to communication, assistive technology, executive functioning, and functional skills. And we've utilized some competitive funding to offer all of our lead agency networks an opportunity to think through the types of training and professional development that would best fit the needs of their teachers and really build the capacity for all of our early childhood professionals to feel like they can provide those supports for children and really increase a mixed delivery system where we see all of our different early childhood programs with the ability to provide those services for children.
And Marcia, I think you were going to cover our Colorado piece on.
Sure, I'm Marcia Blum from Colorado. I'm part of the 619 team. And I'm going to start with our lessons learned. And the first one was really to think about connecting strategies to licensing. Our PDG strategies that we selected are really around universal foundations, and they're focused on mindset. And what we really want is folks in the field and folks in childcare and early learning settings to really understand that inclusive practices for children with disabilities can be provided across all early care and learning settings. And it lays a foundation for this mixed delivery system and understanding of inclusion. One of our challenges in Colorado is really around that we already have a well-established system through the public funded preschools in LEAs and administrative units serving preschool children with disabilities. 92% of our children who have an IEP are served in integrated settings already. With special education and related services inside the classroom. But what we found, and one of the barriers for many families, is that while they have access to an educational setting, they often need care that goes beyond some of the hours. And so I think our focus and our collaboration together around not only these courses, but the Universal Design Project is really expanding the capacity of care providers and improve communication between early care settings and the educational settings so that families' broader needs can be met. So we really have the ability to offer these experiences. We just really need to get that mindset and knowledge out there.
Great strategies. Thanks, everyone. Let's move to our final question. And that is, what are some of the evaluation data used to inform decisions at the state level for the inclusion or planning for the inclusion of Part C and Part B in the early childhood mixed delivery system?
Hey, this is Britt Braun from Louisiana to kick us off for this question. So twice a year, the Louisiana Department of Education performs a child count, producing an unduplicated count of all publicly funded birth to 5 children by site, by age, funding source, and that takes place within each of our different communities with the support of our early childhood community networks. And so within that count, each funding option contains both a general education and a special education category so that we can accurately capture how many publicly funded children within each age band are receiving special education services. And we also collect ongoing feedback on this process. And it was noted pretty consistently that reporting of children with disabilities specifically was not as standard across each community. And so as a result of that, we increased our stakeholder engagement and met with our individual community networks who walked our team through their process of child count that was really specifically pertaining to young children with disabilities to really determine whether children were being captured in the correct special education category and whether our special education population was seemingly undercounted or duplicated within that count. And so looking ahead, to a collection process where data is accurate and can be compared to statewide information, we'd like to determine whether or not our IDEA only categories can be an indicator for non-inclusive classrooms, and eventually compare that to our indicator 6 data so that our local community networks can really monitor and track their mixed delivery systems through the monitoring of data using this process.
This is Kat from Minnesota. In Minnesota, we've really been trying to think about data in some new ways, expanding past how we traditionally think about data. We are working with Sherry Killens from Build Initiative, for those of you who know Sherry. In our work with her, she often shares, take quotes, not notes. Direct quotes from families, communities, and providers have been perhaps and continue to be the most important data that we can gather as we develop and continuously improve mixed delivery systems, because it comes from the very people that we are building the mixed delivery systems to serve. Listen to, believe, and find ways to do what they are telling us as data. They know what they want and need for their families, and it's our job to build it for them. For example, through our PDG and many partners, we've been successful in Minnesota at achieving a supported joint powers agreement, or a JPA, for more streamlined ability to share data across our state agencies. Not that it's been simple, and not that it solves everything by any means, but this came out of family and community engagement around how to have better coordination for eligibility and services in our Minnesota early childhood systems. We are approaching things carefully and intentionally with this, as there are many critical factors to consider, such as not all families want their data shared with other entities. So it's critical to maintain individual family-led decisions and power with who has access to what, which we're good at in Part C and 619, right? The individualization. It's really important to give the process of developing a JPA the time that it takes to do it thoughtfully and carefully with family engagement through our PDGs, or in partnership with our PDGs and each other. Many families and communities whom the systems were created to marginalize and continue to marginalize today have good reason to be distrustful of state agencies more easily sharing data with one another. It's critical that we involve these families and communities from the development level, listen and learn the whys, disrupt paternalistic actions in data sharing, and give the time and transparency for trust building and follow through with each and every family. We must always pause and come from the family's perspectives when it comes to data and data sharing. Remember, quotes, not notes. This equitable individualization for mixed service delivery is what Part C and 619 are built on. This is a strength that we can bring to mixed delivery systems and expanded data definitions in our work with PDG and each other.
And hi, everyone. This is Kristen again from Colorado. In Colorado, we had several pieces of information that really helped shape our PDG strategies around better integration of Part C and B into our broader mixed delivery system. So the first is that the Colorado Department of Education P3 office worked with local experts at the Pele Center to really do a deep dive into investigating the quality of inclusion where children with disabilities are being served. And through a number of data points and good interviewing of all sorts of stakeholders, came to understand areas of opportunity where we can improve the quality of inclusive services that children are receiving, whether they're in a school-based setting or in a community-based setting. Also through the PDG process and our very comprehensive and parent-informed needs assessment, we found that increasing access to inclusive care settings was one of our state's 12 key needs for the broader early care and education system. And we found that insofar as parents, 1 in 7 parents that were surveyed as part of this needs assessment, there were thousands of parents surveyed, indicated that their child had some kind of delay, disability, or special need. And of those, 34% indicated that they were not able to access their care setting of choice because of that provider's inability to accommodate their child. So these things in conjunction really emphasized for us as a state, and hopefully you've heard through the strategies we described, the need to ensure that our children are able to access their early education regardless of their setting, feel supported and included, and that be true by increasing the capabilities of our community-based childcare providers that are not associated with the school district, by increasing the quality of our inclusive practices, both in the community-based setting and in the school district setting, and really making sure that we're increasing that communication between our early care and education providers and our Part C and Part B programs. Thank you.
Thanks everyone for that information and great conversation. That concludes the strategies for Part C and Part B 619 integration into a mixed delivery system panel discussion. And I wanted to thank Richard and everyone on the panel for their participation. I also want to remind viewers to visit the PDG Birth through 5 TA Center webpage and reach out to the PDG B through 5 TA Center for supports and resources. The center supports states in building and enhancing and expanding birth through 5 mixed delivery systems and high quality B through 5 programs and services. It also provides general technical assistance to all states, along with the support that is designed to meet the needs of the individual PDG grantees. Technical assistance is provided through a variety of formats, including a national convening, peer learning opportunities, workshops, webinars, toolkits, resource documents, and individual consultation with state staff. Thanks again, everyone. Okay, Faith, I think that is it. We were about 40